Medicare open enrollment is underway. It's the time of year to find that perfect balance between your budget and your health needs. And our next guest wants to help you shed any confusion and make your best decision. Mark Briggs is the CEO of United Healthcare Medicare and Retirement in Nevada, and he joins us now. How are you, buddy?
Good.
It's great to have you back.
Good to be here.
Let's talk about annual enrollment, annual open enrollment. This is a super important time for anyone that's on Medicare. Why is it so important?
Well, for those that are Medicare eligible, this is the one time each year that you have the opportunity to choose a plan for the upcoming year. So you may have had changes in circumstances or your budget, and you need to factor those in. You need to look at what plan you've had, and this is the opportunity. Medicare is not a one-size-fits-all program.
Yeah.
So take a look and find the plan that is best for you, and I really encourage everyone to take that time during this period.
And there's a lot of time to be taken. This is a very confusing time for people. They have Excel spreadsheets. They got like a map with the pins and the lines. They're trying to connect all the dots. Is there a way to make this any easier? Is there any resource out there?
Well, it can be confusing.
Yeah.
So we conducted a survey this past year. We found that 40% of the responses said that they do find the program confusing.
Yeah.
So if you find it confusing, you're certainly not alone.
Of course.
It doesn't have to be that complicated, though. So we're here to help give you some tips on choosing a Medicare plan.
All right, cool.
So first, look at your current plan. See if that's been meeting your needs. See if there's been any changes in the plan that may have had changes in the premium, the copays, the deductibles. Make sure you're aware of that.
That's the one thing to keep in mind, is that even though you might be on the same plan, things could have changed.
For example, prescription medications. Look at those. Those may have changed what coverage they have on the plan. Make sure the medications you take regularly are still available and you know what the costs are going to be. Make sure that any doctors or hospitals that are important to you are included in the network. Look for value-added benefits. There could be things, many people are surprised that dental, vision, and hearing, that is not included in original Medicare.
Yeah.
So with Medicare Advantage, that's often included. And then finally, take advantage of wellness programs. I highly recommend you see your doctor at least once a year, have a comprehensive exam. Those wellness programs are designed to keep you healthy.
Absolutely. Medicare Advantage has actually really increased over the past several years. What exactly is Medicare Advantage? Why has it become so popular?
So Medicare Advantage takes original Medicare Parts A and B and combines it into one plan. It has grown in popularity. So there are actually 10,000 Americans turning 65 every day.
Wow.
So there's the aging in of the baby boomer generation.
Of course.
But Medicare is also gaining popularity within those that are Medicare eligible. And there's several reasons for that. There is the simplicity of combining it all into one program. There are the value-added benefits that I mentioned. That also could include things like transportation, fitness programs, hearing aids. Again, none of that available under original Medicare. In addition to that, Part D coverage, so that's prescription drug coverage, often included with Medicare Advantage plans. And then there's predictability of costs. So with original Medicare, often Medicare will pay 20 or 80% of the cost, leaving you responsible for 20%. Yeah. There's no limit to how much you could pay for any given year.
Yeah.
With Medicare Advantage, there's an annual out-of-pocket maximum. Once that maximum is reached for covered services, everything else is covered.
That's perfect. That's fantastic. And this can actually, I mean, the plan itself not only can help you get the health care that you need, but can actually positively benefit you when it comes to your health and your well-being as well.
Absolutely.
Yeah, it's making sure that you have the right pick. So let's explain the parts to me again. This is very confusing. So you got A and B, those are regular Medicare. What's the difference between A and B?
So A and B is original Medicare.
So it's the same thing.
Well, they're both covered under original Medicare. A is for hospital coverage, kind of inpatient services. B is doctor's visits and outpatient services.
Okay.
And so B is where Medicare would pay 80%, you would pay 20%. Then there's C, which is Medicare Advantage plans, combining them both into one plan.
Gotcha.
Offered by private insurance companies.
Okay.
D is your prescription drug coverage. Now, that's often included with a Medicare Advantage plan. Or if you have original Medicare, you could purchase prescription drug coverage separately. So those are the A, B, C's, and D's. And then in addition to that, there is Medicare Supplement or a Medigap policy. And that is a policy you could purchase to help supplement Medicare and would cover some of those things, your co-payments and co-insurance that Medicare doesn't cover. Yeah. It would pick up part of that.
All right. There we go. That's the clearest I've ever heard it explained, by the way. I always hear the ABCD on air. I never really knew. Now I know. Resources available. Where do we go if we want to get
So to find more about United Healthcare Plans is uhcmedicarehealthplans.com, or just general Medicare education is medicaremadeclear.com.
Awesome. It's great having you, Mark. Thank you so much. All right, hey, let United Healthcare help you make an informed decision for Medicare annual enrollment. You can visit the website or call the number you see right there on your screen. United Healthcare is a proud sponsor of the Morning Blend.